How's it going?
Hanging in there, man.
Once the bar is perfectly in position, your chest is corrected. Are you finding that your breathing when walking briskly seems to be less labored, that you're starting to feel maybe some additional aerobic ability that you didn't have before the surgery, or is it too early to tell?
No, and I can tell in walking there's certainly a difference. I mean, it's much more comfortable for me.
And of course, I'm sure the question in your mind is, when can I do those sorts of activities? And I really want to discuss, where you go from here, because I think it's important for you and patients who will get to this point in their rehabilitation to understand this phase of their recovery. And now that you're walking briskly, I think we can now start to build some strength and flexibility back into your activity repertoire. And that means that going back to the gym and doing some formal range of motion and resistance training is very, very crucial in getting you to a point where you can return to all activities. What we try to recommend is that 3 times a week you do some very light resistance training, which is using 5 or 10 pound dumbbells, and do a routine that gets you to use your chest, your back, and your shoulders again, where you're increasing your resistance, you're increasing the repetitions slowly, and you're getting full range of motion back in your shoulders and in your back and in your neck. So every other day you should do something that involves, running or biking. You can even bike a little bit, and that could be just a stationary bike. You can even add in there a little swimming, just do a typical crawl stroke very slowly, but in the water, very, very low impact, a very good way to aerobically get back to where you were before. And in addition to that, on an every other day basis, do some resistance training. Light weights, things like seated presses, a fly, a lat pull down, a pull over, a row. Very, very simple movements with very light weight, but it will, over time, return you to normal flexibility and regaining your strength. Okay? And I would say literally by 3 months or so, you should have the aerobic stamina and strength to return to the dance studio and do some dancing. Again, you're going to have to listen to your body and use your experience as a dancer to know what you should or should not do early on. But I would think that by sometime between 3 and 6 months is going to be something you can expect to achieve. Okay? So I think that's the exciting part, because I would predict you're going to be able to do things that you've always done and feel better doing them. Feel like you have more strength and more stamina doing them.
Hey, Barry.
How's it going? You're out there doing things that you were unable to do before.
Wow. Amazing. Thank you so much.
You're welcome.